Good morning, everyone. Whether you're making breakfast or packing lunches, butter is a staple in many kitchens across the country. But today, we're starting with an important update that could affect what's in your fridge right now. There's an urgent consumer alert you need to hear about, a major butter recall that could impact your daily routine and your family's safety. Bunge North America Inc., a well-known food company, has issued a recall for its European-style butter blend. The reason? The product contains milk, but the label fails to mention this crucial ingredient. The U.S. Food and Drug Administration, or FDA, has classified this as a Class 2 recall. That means there's a real, though temporary, health risk for some people, especially those with allergies. Over 64,000 pounds of this butter have been distributed, and it's possible that some of it is sitting in refrigerators and on store shelves all across the country right now. For families with milk allergies, this is more than just a labeling mistake. It's a hidden danger that could trigger a severe allergic reaction, including symptoms like hives, swelling, difficulty breathing, or even anaphylaxis. The recall was first announced on July 14, 2025, and the FDA took further action on July 30th to make sure the public was aware and to escalate the warning. This timeline shows how quickly food safety issues can develop and why it's important to stay informed. Thankfully, as of now, no illnesses or allergic reactions have been reported, but the risk is still present, and the goal is to prevent anyone from getting sick in the first place. That's why it's so important to check your fridge and pantry. If you have this butter, remove it immediately and follow the recall instructions. Don't take any chances with your health or your loved ones. This situation is a powerful reminder of how much we rely on accurate food labels, especially for the millions of Americans living with food allergies. Even a small oversight can have big consequences. An undeclared allergen, like milk, can lead to life-threatening emergencies. For those with allergies, every meal requires vigilance, and mistakes like this can be terrifying. We'll break down what you need to know to keep your family safe, including how to identify recalled products and what steps to take if you find one in your home. Let's dive deeper into why undeclared milk is so dangerous, how to check your butter at home, and what you can do to protect your family from hidden food allergens. When we talk about undeclared milk, we mean that a food product actually contains milk or milk-derived ingredients, but the packaging or ingredient label fails to mention it anywhere. This might sound like a small oversight, but it's a big deal, especially for people who rely on labels to avoid allergens. For individuals and families managing food allergies, this is a serious issue. They carefully read every label, sometimes spending extra time at the store, just to make sure the food they buy is safe for themselves or their loved ones. Undeclared milk usually happens because of a mistake during manufacturing or labeling. Sometimes recipes change or a product is made on shared equipment, and the label doesn't get updated. Other times, it's simply human error in the packaging process. For most people, eating a product with hidden milk might not cause any problems. But for someone with a milk allergy, even a tiny amount can trigger a severe allergic reaction, which can quickly become a medical emergency requiring immediate attention. A milk allergy is when the body's immune system mistakenly sees milk proteins as harmful invaders. This can cause symptoms like hives, swelling, trouble breathing, or even anaphylaxis, a life-threatening reaction that needs urgent treatment. It's important to remember that a milk allergy is not the same as lactose intolerance. Lactose intolerance is a digestive problem, causing discomfort like bloating or stomach pain, but it's not life-threatening. That's why U.S. law requires food companies to clearly list 9 major allergens, including milk, on every food label. This helps people with allergies make safe choices and avoid dangerous reactions. When a product like this butter blend leaves milk off the label, it's not just a simple mistake. It's a violation of the law and a real threat to public health. Families managing allergies depend on accurate, honest labels to keep their children and themselves safe. They trust that what's on the label is what's actually inside the package. When an allergen is left off the label, that trust is broken. It can lead to accidental exposure, putting people at risk of serious harm. That's why recalls like this are so important. They help get potentially dangerous products off the shelves before someone gets hurt. Food companies have a responsibility to double-check their labels and follow strict quality control. Accurate labeling isn't just about following the rules, it's about protecting lives. The FDA classifies recalls into different categories to help the public understand the level of risk associated with a product. These classifications are crucial for both consumers and companies, as they determine the urgency and type of response needed. The classification system is designed to show how serious the risk is and to guide people on what actions to take if they have purchased or consumed the affected product. In this case, the butter recall is labeled as Class 2. This means that using or consuming the product could lead to temporary health problems or health issues that are medically reversible with proper treatment. It's not the most severe, but it's still important. Class 1 is the most severe recall, reserved for situations where there is a reasonable chance that using the product will cause serious health problems or even death. On the other end, Class 3 is the least severe, used for products that are unlikely to cause any health problems but still violate FDA regulations. For people with a milk allergy, eating this butter could trigger an allergic reaction that might require medical attention. Symptoms can include hives, swelling, stomach pain, or even more serious issues like difficulty breathing. While permanent harm is unlikely in most cases, allergic reactions can escalate quickly and become dangerous, especially for children or those with severe allergies. The FDA's role is to oversee the recall process, ensure the company follows proper procedures, and make sure the public is informed through press releases and updates. In this situation, Bunge North America acted voluntarily to recall the butter, but the FDA's official classification adds a sense of urgency and helps alert more people. Even if the risk of death is low, the potential for harm is real, especially for vulnerable groups like children, the elderly, or those with compromised immune systems. For families with allergies, this is a serious warning. Always check your products, read labels carefully, and stay updated on recall information. If you have the recalled butter, avoid using it and dispose of it safely to prevent accidental exposure. The recall system is there to protect you and your loved ones, so always take these warnings seriously and stay informed for your safety. Here's how to identify the recalled butter in your fridge. Look for NH European-style butter blend, sold in 1-pound blocks. The key is the lot code 5064036503. Check for this number on the package or near the expiration date. The UPC code is 10078684739612, found under the barcode. The affected butter comes in white paperboard cases with 36 1-pound blocks. If your butter matches the lot code, it's part of the recall. Don't eat it, especially if anyone in your home has a milk allergy. Even if you don't have allergies, don't serve it to guests. The safest move, throw it away or return it to the store for a refund. Checking these numbers only takes a minute and could prevent a serious health issue. Stay vigilant. Your attention to detail matters. If someone with a milk allergy eats this butter, symptoms can appear within minutes or hours. Watch for hives, eczema, stomach cramps, vomiting, diarrhea, coughing, wheezing, or swelling of the lips, tongue, or throat. Even mild symptoms can be distressing, especially for children. The most dangerous reaction is anaphylaxis, a life-threatening emergency. Signs include difficulty breathing, a sudden drop in blood pressure, rapid pulse, or fainting. Immediate treatment with epinephrine and a call to 911 are critical. This is why undeclared allergens are so serious. Families managing allergies read every label. A mistake can bypass all their precautions. Food manufacturers have a huge responsibility to get labels right. Accurate labeling is a matter of life and death for many. If you find the recalled butter, don't eat it. Set it aside and label it so no one uses it by mistake. Dispose of it in a sealed bag or return it to the store for a refund. If someone with a milk allergy has eaten it and shows symptoms, follow their emergency plan and seek medical help immediately. Even mild symptoms can worsen, so monitor closely. If someone without a known allergy reacts, stop them from eating more and get medical attention. Report any reactions to the FDA's MedWatch program. Use this recall as a chance to talk with your family about food allergies and safety. Staying informed about recalls helps protect everyone. Bunge North America Inc. is a major food company based in Missouri. They voluntarily recalled the butter after discovering the labeling error. The recall covers 1,800 cases distributed to 12 centers across the U.S. and one in the Dominican Republic. That means the butter could be in homes, stores, or restaurants in many states and even internationally. The company is working with the FDA and local authorities to notify everyone affected. This recall shows how quickly a single product can spread across the country, and why fast, clear communication is essential. Our food system is interconnected, so recalls must be swift and thorough. This recall is part of a bigger trend. Food allergies are on the rise in the US and worldwide. Emergency room visits for food allergies have increased by hundreds of percent in recent years. Over 33 million Americans, including 6 million children, live with food allergies. For them, accurate labels are a lifeline. Milk is one of the most common allergens, especially for kids. The FDA and USDA oversee hundreds of recalls each year, most due to undeclared allergens. While frequent recalls might sound alarming, they show the safety system is working. Each recall is a lesson that leads to safer products and better processes. The scale of this butter recall, over 64,000 pounds, shows how important vigilance is. Strong regulations and oversight are essential to protect public health. This butter recall is about more than just one product. It's about trust and safety. Accurate food labels empower us to make safe choices, especially for those with allergies. When labels are wrong, lives are at risk. Laws requiring clear allergen labeling and quick recalls are critical safety nets. The recall process protects everyone, not just those with allergies. Food safety is a shared responsibility. Companies, government, and consumers all play a role. By staying informed and acting quickly, we help keep our food supplies safe. This recall is a reminder of the importance of strong regulations and transparent communication. Being an informed consumer is one of the best ways to protect your family. We'll keep bringing you important alerts to help you stay safe and healthy.